My name is Madeline, and I'll be talking today about careers in neurology. So I am considered to be an assistant professor with an academic clinician appointment. What that means is that I have a combination of academic and clinical responsibilities, with most of my responsibilities being primarily clinical. So at my hospital, there is a number of different types of career paths, but because I really pride myself as being a clinician, I chose a path that primarily allows me to see patients. My week is split up in the following way. I have 2 days where I see patients at a satellite suburban practice, and during that time I see a variety of patients with general neurological problems. On one day, I will spend time at the main hospital, where I get the opportunity to not only teach residents in clinic, but also participate in a more specialized subspecialty program. And for me, that is 2 programs. I have the headache program and the 22q syndrome programs. I spend another day doing mostly procedural activities such as nerve blocks, Botox, EEG reading, and consultation at a nearby hospital in the community. On the 5th day, I consider that to be my academic day, and that means I actually get to get caught up with my charts. What I enjoy about my schedule is that no 2 days are the same. I love that I have a mix of some clinical responsibilities, some teaching responsibilities, some opportunities for research, and just some opportunities for collaborating with some of my colleagues. Being at a large program, again, I love the opportunity to really have lots of people to discuss some patients with, and if you have a difficult patient or you have an interesting patient, there's always somebody next to you so you can chat and sort of discuss what's going on with that patient. I've been in practice for about 10 years. I have been at a number of centers. I would say I've been at a larger program. I am at a larger program. I've been at small programs, and I've been at medium-sized programs. And throughout them, I feel like what I have enjoyed the most about being at any of the programs is really the opportunity to see great patients and great families. And I think that's really what I cherish the most. And so even as I spend time teaching residents, I really try and foster a relationship with families that they can hopefully learn from, and also an opportunity to really be more of a holistic doctor that looks at the patient not only for their neurological problems, but for their entire problem. I hope this is helpful. I know you will find a lot of different types of practices where neurologists seem to do lots of different things, but if you have any questions, please don't be afraid to reach out. Thank you for listening.